for phlebotomy, I don't have, where'd that go? I'm going to pretend with this right here. Here we go. This is skin protectant, but I'm going to pretend it's alcohol. All right. So we're going to prep our stuff with phlebotomy. Same thing, check your orders because it's important that you know what type of tops you're going to draw. So typically, you guys see the little fluid in the bottom of this.
Mm-hmm.
Your blues, that's a coagulant in there, so it keeps the blood thin. So these are going to usually be your PT, PTT, INR, that type of stuff. So it's got basically an additive in there for the blood. So if they want coags, usually blue top. If they want a CBC, usually purple top. If they want a chem panel, we usually do tiger tops. Thyroid, you can usually do tiger tops. Sometimes they'll draw lithium levels. Those are usually gray tops. It just depends on the lab. So the biggest thing is when you see your lab order is that you look at each lab they order and match up your thing to every lab so that you get it covered. The last thing you want to do is go in and stick a patient and say, oh, they wanted a blue top and I forgot it. Because you can't always pull from other ones. So make sure you have all your tubes. So this guy's he's going to get his INR checked, we'll say. Okay. So I have that. First thing I'm going to do is going to go ahead and set this up. You guys should have these in your kits, yes? Mm-hmm. Okay. Black top's the needle, and this top is going to be what goes in here. So you're just going to twist it like so. There is a needle in there. You have to keep in mind that goes through these cork tops, so it's probably going to be pretty sharp. So don't jack yourself with that needle, okay? So that's just going to go straight into here, and then we twist it onto there. Device in place. We got it? Mm-hmm. All right. Then we're going to I usually put my first one just right there like that. It's not attached, it's just in the little thing, okay? And I set that there. Then I'm going to put my tourniquet on.
Do you have to wipe the top of that blue top?
No.
Okay.
No, they're all clean. And it's kind of concave, so, you know, it's kind of in there. You don't have to do anything to it except stick it in there. Okay. All right, tourniquet's going to go on. Now, with phlebotomy, we're not going to be picky. You don't have to start down here. Most of the time, they'll go right here. Okay. So I would just say, if I'm going to get this, I'm just going to go right here in this little vein and draw some blood there. So I'm going to take my alcohol swab right here and going to clean like so. Then I'm going to go ahead and pull this off. All right. So bevel up, right? Mm-hmm. So make sure the bevel of my needle's up. I'm just going to pull the skin back kind of taut. And you're going to want to pull the skin back. If you don't and they have skin there, it's going to crinkle up and get in your way. So it's important to pull that skin back taut. Okay, bevel up, and then I'm going to go ahead and put this in his arm, and then put this on. And I missed. You don't?
Vacuum's no good.
It might not be. It's kind of wiggly. So anyway, I would put the vacuum, and don't do this on your patients, please. That doesn't look like it feels good. Okay, so I got in there. I'm going to put this on. The vacuum might be broken. I don't know. So I need this. Then I'm going to go. Tourniquet stays on with this. You need the tourniquet on while you're getting blood. So I'm going to do this. The biggest important thing I can tell you is when you're switching tubes, because most likely you're not always just going to get one. Stabilize. This hand should be an anchor. So it should stabilize this encasement here like this, like it should rest on them and not move. So when I pull this, that comes off. I grab my next one, I put it on, and you guys notice my needle's not moving at all, right? Mm-hmm. Because how many of you have had your blood drawn and they're going, oh, here, let me change it, and it goes in a little farther every time they change it?
And it hurts.
Yeah, and it hurts. Don't do that. It's really easy. All you do, I just kind of press my finger down, kind of firm on the patient, and hold this so that it can't move at all. And it's very simple.
And you're left-handed, right?
I am, but I do things weird. I can do everything. I really only write neat left-handed.
You can do both.
I don't know how I'm doing this.
Oh. Because I set it up because I thought
Am
you
I
were
doing it left-handed?
Right-handed. Yeah.
Okay.
Okay.
I just do it. I don't know. So anyway, I've drawn my blood and everything. I'm all done. So it's in there. I'm going to take this off, put it here, go ahead and take my tourniquet off. The biggest thing that I'll get you for is, number one, if you ever let go of this, you never leave a needle unsecure, period. If you let go of your needle, we will fail you. Or if you leave your thing on and decide to just leave that vacuum seal on there and pull it out of your patient's arm like this, because that's going to pull all that blood to the surface and they're going to have a nice hematoma right there. So don't let go of your needle, and these come off before the needle comes out of the arm all the time. Okay?
So when we actually do it, does it actually fill up if it works right?
Yeah.
Yeah.
It should. This might be old. I don't know if the vacuum seal's working on it or not.
There's a whole box of them. You want to try another one?
Once you break the seals on these, you can't reuse them. So if you missed, say you stick them and you missed and you're not getting any blood, then you'll have to go get another one before you re-stick them again to get it, because the seal's broke, it's broke, so that's trash.
I don't know if you want to try another one. Probably the whole box is, if they're old.
I need to get my tourniquet tight enough, maybe. And be careful on some of the little elderly patients about how tight you put that, because it'll leave huge bruises on their arms. You don't want to do that. Alright, so bevel up again. I'm going to go in here. Let's see if we find something that's popping. Let's try this one again. I cleaned this already, okay? But I'm going to go in here. Should be good. There we go. So you guys see it coming in there now? So that's what it's going to do. And then you would just stabilize this. You usually want to make them about 3/4 of the way full. And then you'll take it off and get your next one. Take this off. And then you have your little Band-Aid or whatever. Put that in there. Any questions about that? It's just a matter of getting your weight. Yeah, I can't tell if I do it left-handed or right-handed. Would right-handed people do it this way?
Yeah.
Alright, so next thing I'm going to show you the butterfly needle. And this is like, these don't count. Sometimes I think they're more of a pain than using these, to be honest with you, if you're not
Familiar with it.
with them, they will be.
The lab people use them all the time.
Alright, so with this, it's very similar to your other apparatus that you have. These are reusable, so don't throw them away unless they get soiled, because it's not really an infection control issue, they're just reused. If they get blood on them or they're visibly soiled, then you can get rid of them. So same thing with this, there's going to be a needle in there, so don't poke yourself with that. It just goes straight into here. See? And then I put my, what is this? Like this, you get that prepared. You'll go ahead and put your tourniquet on here again. And you'll clean your spot. And now to me, it's hard. This is always typically harder for, make sure that's on tight too, yeah. This is, to me, is typically harder for new nurses to use because they can't manage their hands.
I see them, the lab people kind of lay it down in the bed like that,
Yeah.
but then you're not really in control of it either, so.
So what I do is like this. So I go find this is my vein here, bevel up, you guys see bevel up? You can use these like so if you want to kind of guide it into the vein. We'll say we're going to go here. Okay, so you have to hold your needle and then you're going to go like this, and then it should be pulling. I don't know if it's
That's another bad tube, I guess, because you're definitely.
either that or I'm bad, but it looks like it's in the vein. And then you would just do it like this, but you have to hold the needle. So here's the trick with these, is that you only have 2 hands, so you have to make sure everything's lined up here. So if I was going to pop this one off, I'd do that. Now you can let go of that, you just can't let go of your needle, and then you just put this one back on here. So you have to have everything in the general vicinity to use this. So sometimes it's a little bit more difficult because you're dealing with, it's got its pros and its cons. Okay, so you got your blood, everything's done, then we would just pull our thing out and be done. Just like that, and put it in sharps. Any questions? So yeah, that's like the Cadillac part. People like to use this. If you ever get a hard stick or somebody, you know, these are usually 22s or 24s. I think this one's a 21. They're smaller. You'll have some patients come in and say, I'd like a butterfly needle, please. Because these needles here, where'd my other needle go? Right here. These ones are typically 20s. So they're a little bit bigger. And so patients obviously like the smaller needles. And some people will just get on the kick where this is all their use.
Gotta be careful those, because some labs that you draw, if the needle is too small,
It'll lyse
it will
the
break
cells.
down those cells, and then the lab will be calling you, going,
CBCs
I
are
need
gonna be
another
really
CBC, and then you have to stick the patient down.
So 20 gauge again is your magic number. So you would be fine drawing with this one, but if you drew a CBC with this, which is a 21, you're probably going to have to redo your CBC because it's going to lyse those red blood cells and stuff, and they won't be able to run adequate tests on it. So that's these are okay if you like these, but in my opinion, nurses that get spoiled with these, they lose their skill with this. So, you know, if you can go back and forth and maintain your skill level, then it's fine, but I would never get just dependent on this.
Are those sometimes used for people that have bad veins?
Yes.
in their veins?
Yeah, if they have little veins or bad veins and they blow and stuff, they'll use them a lot.
Seen them use them for IVs too before for really, really horrible
Yeah.
sticks.
And
It's
this
not
is the
good.
IVs you'll see on PD patients when we do the fetal scalp. When we put them in their scalps, they have big little, and they're usually about 24s or 26, so they're even smaller than that. And that's pretty small, but they're really small. 26, I mean, just going to the little scalp veins. So, yeah, you'll see it on the little old ladies and stuff. I don't use hand veins, period. That is my personal preference, because in my opinion, they don't last, because they don't last for IVs, I'll tell you that. And they hurt. I mean, your hands are much more sensitive than your arm, to me, and it hurts a lot of people. And a lot of times you're trying to draw a bunch of blood out of it, and they'll blow. So then, guess what? You have to stick them again. If you can get one of these arm veins, they don't hurt as bad, and they can usually handle the pressure. Hand veins are not always the best.
And I think from a longevity standpoint,
They're not
if
good to
you know, if you're going to be in the hospital and you're trying to like eat and everything, and you know, like your one hand is completely not, and if you put it in somebody's dominant hand, they're really not going to be
They
happy
did.
with you.
After I had my daughter put my right hand, I'm right-handed, and I was trying to nurse her. I was like, I can't.
Yeah, it's.
Yeah, or they try to wipe their butt. Imagine that. And, you know, stuff like that. I mean, you don't wipe your butt with your arm, so
Yeah,
there's a
but
perk
they
there
do
too.
in maternity, they always put it in your hand so you can hold your legs.
Yeah, I don't know why they do that.
Yeah, that's what they told
They
me.
didn't do
I was
that.
like,
They
why
didn't do
did
that
you
in
put it
mine
my
because I said,
hands?
okay, I would like a, I'm gonna like a 20, right? Because they come with 18s. I said, no, a 20, and this vein right here looks good. They'll say, well, you know, we really, and I said, okay. I said, I'm not lacking in veins, so we'll start here and then we'll work our way to there.
Yeah, I asked her why. She said that they put it in their hands so that like the girls who like to hold their legs or help pull, which I didn't do any of that, but
It can still be on your arm
It can still
though.
be in your arm.
I had a little newbie nurse
My
when I
aunt did. She,
had
like,
my